Hello friends, welcome my channel. Today's discussions antihypertensive drugs, sympathetic inhibitors, beta blockers. So friends, beta blockers drugs names are atenolol, carvedilol and metoprolol etc. And mechanism of actions: beta blockers decreasing blood pressure by blood vessels, decreasing cardiac output. So friends, you must remember, this is the one point, that if there is this is the vessels and here the blood is flowing normal way, and this is another blood vessels, but here act on sympathetic enzymes, and drugs work and bloods will flow this way, and drugs work is to inhibit these portions. This portion should be inhibit. Then the constrictions, the vessel constrictions reduce vessel constrictions, and blood will flow normally. So friends, mechanism of actions: beta blocker decreasing blood pressures by blood vessels and decreasing cardiac output. So friends, decreasing blood pressure means decreasing cardiac outputs. Another is also decreasing sympathetic outflow from. Also decreasing sympathetic outflow from central nervous systems. So friends, why do we learn this antihypertensive drug? Because we can understand easily drug acting cardiovascular systems. We can understand easily drugs acting cardiovascular systems problem. That's why I discuss sympathetic inhibitors. Now you will now after that, beta blockers decreasing, and so also decreasing sympathetic outflow central nervous systems. Sympathetic outflow means central nervous system decreasing, and beta blockers decreasing release of renin from kidney. This central nervous systems outflow from central nervous system, also decreasing sympathetic outflow. Where is the sympathetic outflow? Sympathetic is outflow from central nervous systems, and beta blockers decreasing release of renin from kidney. And now they also decreasing the formation of angiotensin 2. So friends, whatever we have learned, that angiotensin 2, we learned angiotensin 2. So friends, in my previous video you will see that angiotensin 2 helps increasing blood pressures, and decreasing angiotensin 2 decreasing secretion of aldosterone, decreasing the secretions of aldosterone. Must remember, decreasing the secretions of aldosterone. After that, important portions friends, prototype beta blockers is the propranolol act on beta 1 and beta 2 receptors, and selective beta 1 blockers are metoprolol and atenolol. Selective beta 1 blockers are metoprolol and atenolol. Atenolol is very useful drugs. These drugs is very useful common drugs. And another is nebivolol, beta 1 blocker decreasing production of nitric acids and equals to dilation. So friends, we have learned that nitric oxide. We have learned about the nitric oxide in the first renin-angiotensin system, we have learned that nitric oxide and prostacyclin we get potent vasodilators and potent vasodilators. So friends, it is the decreasing productions of nitric oxide means dilations. And another is selective beta blockers must be used cautiously, and non-selective beta blockers propranolol are not to be used in asthmatic patients due to their blockade of beta 2 and mediated and bronchodilations. And beta blockers 1 decreasing beta 1 at heart and decreasing cardiac outputs. And decreasing renin equals to decreasing angiotensin 2 and decreasing resistance and decreasing aldosterone and decreasing Na plus water. So friends, we know that what is the renin, and we have learned that liver produced angiotensinogen, and renin helps to create angiotensin 1, and angiotensin 1 converted into angiotensin 2. But when renin is decreasing, so angiotensin 2 also decreasing, and decreasing resistance and decreasing aldosterone. Or when decreasing aldosterone means decreasing sodium plus water, and also we know that decreasing sodium plus water means our decreasing blood volume, and decreasing blood volume means decreasing cardiac outputs. So BP should be decreasing, blood pressure should be decreasing. So friends, this is the total antihypertensive drugs, sympathetic inhibitors I have discussed, and thanks for